Hey, Dr. Mike here. You got a toothache? Well, stick around. We got some great tips to help you out.
You're listening to Live Foreverish, a show dedicated to helping you live just a little longer. Here's your hosts, Dr. Mike and Dr. Crystal Gossard.
All right, welcome to Live Foreverish. As you know, nobody likes a toothache. It's definitely not a cause for celebration, but they are impossible to ignore. I say that because there's actually National Toothache Day, Dr. Crystal, February 9th. And of course, it's not celebrating it, it's just bringing awareness to what is unfortunately a very common ailment that could lead to a lot of problems, right? So we want to talk about ways that we can, what causes them, how to treat them, and of course, some nutritional supplements that can help. So right off the bat, Dr. Crystal, when was the last time you had a toothache, or have you ever had a toothache?
I've had a toothache. It's been a long, long time ago, but my toothache was not the typical toothache because, most are due to a cavity or some type of tooth decay. Mine was due to braces. So I don't know if that counts. Does that count?
Well, yeah. Okay. We can get into it. We're going to talk about what causes it, but let's before we do that, regardless of the cause, we're calling these. Obviously, we're using toothache as a large umbrella term, right?
Right.
It could be different causes, but can you think back? Like, what did it feel like? Like, I can tell you, I had a toothache a couple years ago. It ended up being tooth decay. Ended up needing a root canal. It's a big process. And I just remember, for me, it wasn't the worst pain. It wasn't 10 out of 10, 9 out of 10.
Mm-hmm.
It was more like 5, 6 out of 10, but it was constant. This constant throbbing, whether I was trying to sleep, eat, talk, it didn't matter. So for me, it was just aggravating.
Now, did it start with initially, curious, did it start where there was pain when you were chewing something only? Because with appliances in your mouth, like braces, it's initially painful the first couple of days, like especially when you get them tightened. And then after that, it's only when you try to chew something that you feel the pain. So did it start that way and then progress to constant pain?
I don't remember, to be honest with you.
You tried to block it out of your mind.
Because once it became constant and irritating, I mean, that's all I remember, because it was so. I mean, imagine a throbbing thing going on nonstop. And at that point, it forces you to go see your dentist, and then it becomes a big ordeal. So we want to talk today about things that maybe we can prevent that big deal, like a root canal, from happening. But for me, it was throbbing pain. For other people, it can be sharp pain, especially when you bite down on something, like you said. Swelling around the tooth, that's usually a pretty bad sign that there's some infection. Fever, headache. Some people report like a bad taste in their mouth. Yeah, that usually is a sign of infection, along with just bad breath.
All right.
Yeah, I remember my dad had a cracked tooth once. And I mean, God, you couldn't stand 2 feet from him. His breath was so bad.
Really? So it's just the bacteria kind of getting into that crack and
Yep. And just making it stink. Oh, it was horrible. He thought it was great. He's laughing. And, he said, well, at least you guys stay away from me now. That was my dad.
Okay.
Anyway, so those are just, so anyway, I don't think we need to go to the symptoms that much, because people know, right? People get it. But what really is the cause? And we already mentioned one, and this is the big one, right? Tooth decay.
Yeah.
At the end of the day. Too much sugar, simple carbs in our diet, even age itself. You lose the enamel, that tooth begins to decay, and that's going to lead to the classic toothache, right? I mean, that's the big one.
Yeah, and the reality is that the bacteria that is the cause, or that causes plaque formation, really likes sugar. So the more sugar you eat,
so do we. That's why it's the sugar's there.
Maybe that's why we're eating the sugar, because the bacteria is telling us eat more sugar.
Maybe oral brain connection. We're being controlled. Oh no, zombie-like, right? No, now everybody, calm. No, don't send.
Well, hey, there's some truth to it, Dr. Mike. That's another topic.
So we eat a lot of sugar, a lot of simple carbs, and that's why we want to brush, at least twice a day to get that stuff out of there. Do you know why this is just a side note. why we recommend people brush twice a day. It should be 12 hours apart.
No,
It's a
tell
trivia.
me.
Yeah, it's
Trivia.
because research has shown it takes a good 10 to 12 hours for the bacteria that causes the tooth decay, eating the sugar. It takes them about 10 to 12 hours to get to a high enough level to start causing damage.
Wow. So what that means that all these people, and you see them at work. I'm not going to talk about anybody. I think it's great. The overachievers that's in the bathroom
Yeah,
brushing their teeth
don't need to.
after every meal, and then you feel like you walk out with your head hung low, that you're just not as great of a
Yeah.
person
Now
as
listen,
they are.
somebody might be doing that for other reasons and
Okay.
whatever. So we're not knocking that. But if you're simply talking about brushing your teeth to keep the bacteria down that causes tooth decay and cavities, it really only needs to be twice a
Hmm.
day because that's enough to control their growth.
So
Aha.
what about floss, Dr. Mike? I only
Well,
floss once a day.
yeah,
What do
well,
you think about that?
that's we'll get into that. Let's at the end, let's talk a little bit about flossing and what that
Okay.
routine should look like. But coming back to causes of toothaches, tooth decay is the number one. But keep in mind there are several other causes, right? You already mentioned braces.
Right. Yes.
That can cause cracked teeth and stuff like that. My
Mhm.
dad, he cracked his tooth somehow. I'm not. We don't even know how. That wasn't I mean, maybe there was some decay there because he was older, but it wasn't really. It wasn't until he cracked it, and then an abscess formed that caused some of the pain.
Mm.
Trauma. What else do we got? What else can you think of?
Yeah, well, it could be a sinus infection. So
Oh
it,
yeah,
it may not always be a tooth. And the sinus infection, it may manifest also as a headache,
yeah,
and of course sinus issues. It could be a wisdom tooth. It could be maybe you already have a filling and now that filling is damaged.
yeah,
So
yeah. At the
it
end of the
could be
day,
many things.
yeah. So at the end of the day, if if you want to rule out some things, number one, sinus infection. Well, most people can tell when they have sinus issues, right? So clear the sinus issues. The pain's still there. You need to go see your dentist, right? If you
Right.
open your mouth and just look, it's red and inflamed. It looks like that there's a gap between my tooth and the gum. All of these things would be there's blood. All of
Right.
these things would be big signs for you to go and have your dentist take a look, right? Don't you agree?
I agree. And hopefully you can get in.
With it.
Dentists are sometimes hard. It's hard to get an
I
appointment.
got they deal with pain quick. So if you ever want to get into a dentist quickly, even if you don't, well, I shouldn't say don't lie. You shouldn't lie, but just tell them you're in a lot of pain, and then they kind of have to get you in. You didn't know that, did you?
I didn't know that. And so I'm sitting here thinking, Dr. Mike, he can see me and I have this blank stare because now I'm thinking, are there emergency rooms for dentistry? I would imagine that there
No,
are, like just a
yeah, well,
specialty.
most emergency rooms, if they rank emergency rooms level one, two, three. We're not going to get into that, but if you're a level one or level two emergency room, those are big emergency rooms. They do have not a dentist, but they have an oral surgeon on call. So
Okay.
you can go if it's
Hmm.
really bad to an emergency room, or just if you got a good relationship with your dentist, just call and say, "Listen, this is bad. It's throbbing. I can't even. I can barely breathe." They get you in. They're not gonna
Yeah.
mess around with that. And speaking of your dental visits, we don't come on. We got to make this. We got to be better at this, right? I mean, it's supposed to be twice a year. Most insurances pay for a nice cleaning twice a year. We need to be taking advantage of that because, again, how many times we got to say prevention's the easiest way to go?
That's so true, Dr. Mike. And I know it's not really the scope of this conversation, but you've talked about the connection between oral health and chronic diseases,
Yeah, for
cardiovascular
sure. Yeah.
disease, cancer, Alzheimer's disease, diabetes. You're seeing all of these linking back to oral health playing a role.
Yeah, yeah. It's the cardiovascular one's a really interesting story, right? Remember, I told you that I was intern at University of Utah, and during the cardiovascular rotation, I worked with Dr. Michael West, who was one of really the first researchers, cardiologists, to show that the bacteria in a tooth decay area is the same bacteria in an arterial plaque. And so it goes from
Wow.
your mouth to the arteries, gets stuck. Your immune system attacks that. You get damage to the artery. I mean, right there, there's your
Mm.
steps towards arterial plaque, right? Damage, right?
Wow.
Yeah. So very interesting. You definitely need to take care of your teeth. Go see your dentist. I don't, again, at the end of the day, we if it's really bad, you got to go see your dentist. You might need, what are they going to do? They might do root canals. It might even have to be a tooth extraction. I don't know. Hopefully, maybe it's just a filling. Those are always the easiest
Mm-hmm.
ones to do. But I did want to mention before we get into some supplements, Dr. Crystal, if you are at the dentist and there's pain, and they want to do an x-ray, let them do the x-rays. I So many people they refuse the x-ray because they're scared of the radiation, but it's the x-ray that allows them to tell really how bad this is.
Mm.
How deep is it going? Where is there an abscess? Is it
Right.
affecting the bone? And as we talked before, the amount of radiation is pretty low for a dental x-ray.
What about those panoramic x-rays? I took my daughter to get one
Yeah,
yesterday.
it's the same. It's basically low radiation, so it's very
Uh-huh.
low.
Okay.
Those are fine. And it's real targeted radiation too, right? You can't only doctor. Well, if you watch this on YouTube, you can say it really is. It's really following the line of your lower and upper jaw. So you're not. It's
Right.
not getting up into your brain. It's not getting down into your neck. It's very targeted, and overall
Mm-hmm.
it's low dose compared to like a CAT scan of your chest. It's like nothing.
Right. Where they're just trying to get deep
Yeah, yeah. So don't.
into the
It's
body.
it's really important because it gives the
Okay.
dentist an idea of what they really need to look at. So, but let's focus on, how about not having to go to the dentist for those reasons? How about just going to the dentist to get cleanings? Um, and the more you do that, the easier the dental trip is, by the way, right? So don't be scared to do that.
Yes.
I know Dr. Crystal goes about 5 times a year, 3 times a
3.
year.
Thank you very much.
3 times. But I want to start off with one of your favorite topics, right? These are things that can help just avoid that tooth decay overall.
Mm-hmm.
You're a big proponent of this idea of dysbiosis in the oral
Right.
cavity. Tell us about that.
Yes, so that occurs when potentially harmful bacteria that damage teeth and gums overcome the normal balance of bacteria in the mouth. So, we have the good bacteria and the bad bacteria there. It's really about keeping that balance there, and the good bacteria help to offset the bad bacteria. It's really a real estate kind of situation in the mouth. And so we do know that this balance can be improved through probiotic
Yeah.
supplementation.
And now it's specific strains though, right? Do you want, like, I think we should explain that, right? Like, tell us, it's not just a gut general probiotic product.
No, so what we're now seeing in the probiotic literature and research, that specific strains of probiotics, and I'll give you the one that targets the oral cavity to help fight cavities, Streptococcus salivarius M18, Dr. Mike. And so often when you're looking at specific strains, you have to look for the name or numbers after you find after the names of those bacteria, and those strains have been researched to support a different part of the body. In this case, this strain helps to reduce the accumulation of plaque that leads to cavities. So that is Streptococcus salivarius
Yeah.
M18.
And you want to look for that, right? On the label. I mean, if
Right.
it's claiming to help cavities, then you need to see that M18. Yeah. On
Exactly.
the label.
Yeah, that's the form that has been, where we know for sure there is randomized double-blind
Right.
clinical controlled studies to show that this strain can have this effect in the
Yeah.
body.
And and even beyond the oral cavity, I think, again, this is just a side note for the audience. And I know Dr. Crystal and I are excited about it, and it's really the wave of the future. It's strain specific probiotics down the line, right? Strain specific for gut, for brain, for heart, for oral. That's really going to be, you're literally going to have a unique formula for liver.
Right. Yes.
Yeah. So really exciting. I think movement in the probiotic industry, if you want to call it. I love this. To me, it's like using nature to fight nature in a sense, right? And so it's not any toxic thing. And it reminds me. This is just, you're gonna laugh, but it reminds me. Years and years ago, like in my first year of college at UT in Texas, I had a biology professor. Granted, she was a little weird. She was a little out there. Um, and
Uh-oh.
I could go into why, but basically we referred to her as someone who was granola. She was just really into the earth and grounding at that time, which was years
Oh,
ago.
okay. Oh, I haven't heard
Yeah,
that in a long
yeah,
time.
and I mean, she conserved water by only flushing her toilet like every other day or something in her house. Like there, she did. Yeah, she's
Yes,
just there, and that's fine, whatever. But
right.
she was a big gardener, and she would tell us that she's never used pesticides on her garden, and she's never had pesticide or pest problems because she put in her garden a very specific spider that attacks like the different worms and moths that attack
Yes.
those kind of flowers she had. So she was literally using nature to fight nature, and that's kind of what this reminds me of. You know?
That makes perfect sense. I love that. You see that all the time in, some of the more holistic
Yeah.
gardening where they're planting certain plants that can
Yeah. And
help to
and then
keep that
what was
balance.
interesting, again, I know this is a side note, but it's funny, is you then wonder, well, gosh, then did you just have a garden full of spiders and spider webs? No, because certain little small birds would also eat the spiders.
It's the circle
It
of
is. So
life,
she
Dr.
had
Mike.
this like little ecosystem where she controlled everything with nature, and that's essentially what we're doing here in the oral cavity. You got the bad guys, we had some good guys at a high amount, and the good guys overcome, and you decrease cavities in your mouth. I mean, that's cool.
That's right.
Yeah.
Yes. Something else that nature gives us.
Anyway, so that was a
Xylitol.
big aside, but that was fun. That it really reminded me of her. Anyways, okay, let's move on to a sugar alcohol.
Yes, xylitol coming
Xylitol.
from nature as
Yeah, a
well.
lot of people I think have heard of xylitol. There's others, erythritol. There's it, but xylitol specifically. And I don't know. Is it just xylitol, or is it other sugar alcohols that help with cavities? Do we know?
I've only seen with the xylitol,
Yeah.
the research with xylitol. So
So
I can't really.
yeah, and if so, what a great, if you don't want fluoride or whatever in your tooth, and that's a whole nother conversation. Make sure you're
Mhm.
getting some xylitol in, right? A xylitol based toothpaste or something, and xylitol based
Or
mouthwash.
xylitol in your
Yeah.
mouthwash. I looked at after we started kind of researching for the show, Dr. Mike, I looked at the back of my mouthwash bottle and I was mad. There wasn't xylitol in there. So I had to switch it up to find that. I always chew gum sweetened with only
That's great.
xylitol.
Yep. Yep.
Great to chew it after a meal as well. But it not only aids in the prevention of early cavities, but can reverse their early formation. So if you have a little small cavity, in the research, xylitol has been shown to help reverse that cavity, Dr.
That's
Mike.
great news. So that's indicating that maybe even not all cavities have to be treated so roughly, right? Like with planing and
Yeah,
and 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 all that stuff.
y- this idea of I think it's the concept of drill and fill, drill and
Yeah.
fill. It's kind of going
Yeah. Well,
away.
listen, that's the bread and butter though of the day. I mean, I don't know if it's good. I mean,
I
it's hard to
know.
take away the bread and
But
butter.
but listen, there are other things that they're doing. Like I told you, my daughter went to get her X-ray, they now, for her molars are coming in, they put a sealant on the molar.
Yeah.
And so that's one of the other strategies that they're doing. If you have a little cavity, they're not just going to tell you, you don't have to come to
Yeah,
the
they're going to do
office,
something.
Dr. Mike. You're going to get something.
They're going to fry the new bread and butter.
Something's happening.
No, that's great. That's great research. Xylitol is a great alternative if you don't want fluoride, or you can just add it even if you don't care about fluoride, right? It's a great combination. I love the gum chewing. I'm not a big gum chewer. It just bugs me. I can't do it. But that not only does the xylitol help, there's some research that just simply the saliva from gum chewing also helps to keep the oral cavity clean. So that's a good thing. CoQ10. Now, ubiquinol CoQ10 we've talked about for heart, brain, energy. I mean, it's I think we both agree it's a foundational supplement, right?
Right.
How is it, but how does it relate to cavities and gum disease?
Well, we know that gum disease can be associated with toothaches. And we know that orally administered CoQ10 has been associated with reducing inflammation of the gums. So that's where you're seeing that connection with CoQ10, toothaches, gum
Yeah,
disease,
yeah.
helping to target that area.
And now we know. I think both. Working with life extension for so long, I think both of us have talked to people who actually rub CoQ10 right on their gums, which they claim really helps. But you don't really need it. Oral is just fine.
Right. Oral is fine. But yes, we've gotten that question often. Can I puncture, can I just rub the CoQ10? It's fine. It's not going to taste great.
Yeah. I guess you could
you
put it
can
on
do
your
it.
xylitol concentrated toothpaste if you wanted to. Yeah.
Good idea,
Now,
Dr.
the other
Mike.
one, omega-3s, this one you don't want to rub on your gums. Especially, if it's omega-3s from fish, and especially if you're using a high potent product, you ain't going to do that more than once. I don't think, right? But omega-3s, anti-inflammatory, it makes sense, right?
Yep.
Overall, you should be doing these every day anyways, but has been shown to reduce chronic periodontitis, right? Which is advanced gingivitis, basically, in people who had procedures done. I think that's what it was.
Right. Yes. After they had the procedures, that the omega-3s help to reduce the inflammation.
Yeah. Lastly, lycopene. This is an interesting one. When you say that right away, guys think prostate, probably,
Mm-hmm.
right? But it's a wonderful carotene based antioxidant. It actually has heart benefit, sugar. I mean, it's one of those powerhouses in the supplement world. Turns out lycopene is pretty good for lowering oxidative stress, getting rid of some of those sugars in your mouth, and preventing gingivitis and stuff like that.
Yeah.
So there's another option for you. Let's end this by talking about we've touched on this a little bit, but just good oral hygiene in general. Okay.
Yes.
Let's start with brushing your teeth. We already mentioned twice a day is good.
For
Right.
at least 2 minutes.
For at least so many people don't know that. I've seen my friends, family. You go on a trip, you watch them brush their teeth, and it's maybe 30 seconds. And for some reason, the guys are really rough with it too. They're just like 30 seconds. No. Slow down. Go easy. 2 minutes, right? And you go
Yes.
section by section.
That's right.
Nice circular motion. Personally, I think everybody should have an electric toothbrush.
Yeah, that's ideal.
Yeah. Those really get in there. They've been shown. We're going to do a whole show coming up on that, aren't we? Different
Yes,
types of.
we are in March. First
Yeah,
week in
on our
March, LE
Life
Live.
Extension Live. Yeah, so check that out. We go live noon every Wednesday Eastern time. Flossing at least once a day.
Yeah.
If you
Usually at
can't,
night is where I target.
yeah, why not? Right? Give it the day. Get rid of anything that's hidden in there, because those hidden things can cause toothaches. Yeah.
That's right.
Water picks are good too. Do you have to do both if your dentist tells you to? Some people, though, like water picks versus flossing. I'm not going to argue that, but you definitely got to get into the grooves where your toothbrush is not going to get at the end of the day,
That's
right?
right.
All right. Great information. Listen, hopefully, if you're dealing with the toothache right now, if it's bad, go see your dentist, right? You got to take care of it. If you don't, it doesn't, it's just going to get worse. You think the pain's bad
And
now.
it's going to get worse and it's going to cost a whole lot more.
Yes, it's going to get worse. The experience at the dental office is going to be worse, and the cost is going to be worse. So don't wait, right?
That's
Go ahead
right.
now and take care of it when it's not so crazy. We do have a. This is an. Is this an article or a protocol for people?
Protocol.
Protocol. Lifeextension.com/toothache. And boy, it goes into a lot more. Lots of research, lots of additional information there for you. Go check it out, lifeextension.com/toothache. Dr. Crystal, thanks for joining me today. Don't forget, you can watch or listen, depends. You go to YouTube and watch, go to liveforeverish.com and listen. Many, many more episodes. We're close to 400, I think. And when you do, please let us know. Like it, share it, tell us what you think, and subscribe so you never miss a show. That's liveforeverish.com. I'm Dr. Mike. Thanks for listening.